Hello parents, welcome to this very first module where I will guide you how to take care of a chronically ill child. In my career of more than 10 years, I've come across hundreds of patients where kids are the parents and they have chronically ill child. Taking care of chronically ill child is one of the most draining and difficult tasks a parent can face. Beyond handling physical challenges and medical needs, you'll have to deal with your child's emotional needs and the impact that prolonged illness can have on the entire family. Luckily, this tough balancing act does not have to be done alone. Support groups, social workers, and family friends often can lend a helping hand. So in this first module, we will discuss about how you should be explain long-term illness to your child, how to tackle the tough emotions, behavioral issues, how to deal with the siblings, and what else parents should know. So we'll be discussing that one by one in this module. Explaining long-term illness to a child. Honest communication is vital to helping a child adjust to a serious medical condition. It's important for a child to know that he or she is sick and will be getting lots of care. The hospital, tests, and medicines may feel frightening, but they are part of helping your child feel better. As you explain the illness and its treatment, give clear and honest answers to all questions in a way your child can understand. It is also important to accurately explain and prepare your child for treatments and any possible discomfort that might go along with those treatments. Avoid saying this won't hurt if the procedure is likely to be painful. Instead, be honest if a procedure may cause some discomfort, pain, pressure, or stinging. But then reassure your child that it will be temporary and that you will be there to offer support. Many hospitals give parents the option to speak to their child about a long-term diagnosis alone or with the doctor or the entire medical team present. Your doctor or other medical professionals probably can offer many technical advices or to make your child understand about the process better way. Your doctor may give you a number of another patients with their consent, and you can speak to them, and that process from the other parents' view can also be understood by you as a parent, and those things you can tell to your child. So again, it's a very tricky situation where we have to tell the child about how the things are going to unfold in future. You'll have to be very strong, and it's where tackling tough emotions. Your child will have many feelings about the changes affecting his or her body and should be encouraged and given opportunities to express those feelings and any concerns and fears. Ask what your child is experiencing and listen to the answers before bringing up your own feelings or explanations. This kind of communication doesn't always have to be verbal. Music, drawing, or writing can often help kids express their emotions and escape through a fantasy world of their own design. Kids also may need reminders that they are not responsible for the illness. It's common for them to fear that they brought their sickness on by something they thought, said, or did. Reassure your child that it's not the case and explain in simple terms what is going on. You also may want to reassure your other kids that nothing they said or did caused their siblings' illness. For many questions, there won't be easy answers, and you can't always promise that everything is going to be fine. But you can help your child feel better by listening, saying it's okay and completely understandable to have those feelings, and explaining that you and your family will make him or her as comfortable as possible. If a child asks, "Why me?" it's okay to offer an honest, "I don't know." Explain that even though no one knows why the illness occurred, the doctors do have treatments for it. If your child says, "It's not fair that I'm sick," acknowledge that your child is right. It's important for kids to know it's okay to feel angry about the illness. Your child at times may ask, "Am I going to die?" How you answer will depend not only on your child's medical situation, but also your child's age and maturity level. It's important to know, if possible, what specific fears or concerns your child has and to address them specifically. If it is reassuring to your child, you may refer to your religious, spiritual, and cultural beliefs about death. You might want to stay away from euphemism for death such as going to sleep. Saying that may cause children to fear going to bed at night. Regardless of their age, it is important for kids to know that there are people who love them and they will be there for them and that they'll be kept comfortable. Just like any adult, a child will need time to adjust to the diagnosis and physical changes and is likely to feel sad, depressed, angry, afraid, or even to deny that they are sick. Think about getting professional counseling if you see signs that these feelings are interfering with daily function or your child seems withdrawn, depressed, and shows radical changes in eating and sleeping habits unrelated to physical illness. Behavioral issues. In my decade-long career in pediatric ICU, where I have come across many patients who had chronic illnesses, and behavioral issues over the time are bound to happen. Kids with chronic illnesses certainly require extra tender loving care, but also need the routines of childhood. The foremost and perhaps trickiest task for worried parents is to treat a sick child as normally as possible. Despite the circumstances, this means setting limits on unacceptable behavior, sticking to normal routines, and avoiding overindulgence. This may seem impossible, but spoiling or coddling can only make it harder for a child to return to daily activities. When your child leaves the hospital for home, normalcy is the goal. Recently, this 16-year-old girl we had in our ICU, and she was on ventilator for almost 2 months or so. She was diagnosed to have a condition called Guillain-Barré syndrome. She was on ventilator, she could not move at all. Her brain was absolutely normal, but the body parts were not moving at all. And at the day of 78, when she went home, after going home also, there were many behavioral issues in form of depressions and which required attention and professional help later on. So these aspects are usually or often neglected or missed, but if you see changes in your child's behavior, report it to the doctor you are consulting with. Dealing with siblings. Family dynamics can be severely tested when a child is sick. Clinic visits, surgical procedures, and frequent checkups can throw big kinks into everyone's schedules and take an emotional toll on the entire family. To ease the pressure, seek help to keep the family routines as close to normal as possible. Friends and family members may be able to help handle errands, carpools, and meals. Siblings should continue to attend school and their usual recreational activities. The family should strive for normalcy and time for everyone to be together. Flexibility is the key. The old normal may have been the entire family around the table for home cooked meal at around 8 p.m. while the new normal may be takeout pizza on clinic nights. Also consider talking with your other children's teacher or school counselors and let them know that sibling in the family is ill. They can keep an eye out for behavioral changes or signs of stress among your kids. It's common for siblings of a chronically ill child to become angry, resentful, fearful, or withdrawn. They may pick fights or fall behind in schoolwork. In all cases, parents should pay close attention so that the other kids don't feel pushed aside by the demands of their sick brother or sister. It can help if parents reserve some special time for each sibling. It can also help them to be included in the treatment process when possible, depending on their ages and maturity level. Visiting the hospital, meeting the nursing and physician staffs, or accompanying their sick siblings to the clinic for treatments can help make the situation less frightening and more understandable. What they imagine about the illness and hospital visits are often worse than the reality. When they come to the hospital, they can develop a more realistic picture and see that while unpleasant things may be a part of the treatment, there are people who care about their brother or sister and do their best to help. What else should I know? The stress involved in caring for a child with a long-term illness is considerable, but here are certain tips which might ease the strain. Number 1. Break problems into manageable parts. If your child's treatment is expected to be given over an extended time, view it more manageable time blocks. Like you view it in the more manageable time blocks. Planning a week or a month at a time may be less overwhelming. Number 2. Attend to your own needs. Get plenty of rest, and to the extent possible, pay attention to your relationship with your spouse, hobbies and friendships. Number 3. Depend on friends. Let them carpool siblings to the whatever the classes your other kid is going. Let others, relatives, friends share responsibility of caring your child. Remember that you can't do it all. Number 4. Ask for help in managing the financial aspect of your child's illness. The stress of financial burden is at times so overwhelming that it tends to affect your health as well. So make a plan and make sure that whatever the insurance you're having on, try to make it in a manageable way and get help from the person you can get help from your family members. Number 5. Recognize that everyone handles stress differently. If you and your spouse have distinct coping styles, talk about them and try to accommodate them. Don't pretend that they don't exist. Number 6. Develop working partnership with healthcare professionals. Realize that you are all part of the team. Ask questions and learn all you can about your child's illness. Next, you can keep a journal and you can pen down your emotions every now and then. It will help ease out your stress. Consult other parents in support groups at your care center or hospital or online. They can offer certain informations and understandings and their journey which can help ease your stress. And last, utilize support staff or wherever you can offered at the treating hospital. So these were certain tips which as a parent you should consider doing it if you are managing a child who is chronically ill with medical illness.